Make their case to expand Medicaid health insurance to more Arkansans. Good evening, I'm Kevin Kelly. Donna is off tonight. Fox 16's David Goins joins us live at the Capitol, where the beginning of the work to get a possible deal on expanding Medicaid starts now. David?
Well, Kevin, still a long way to go, but Democrats and Governor Beebe are certainly open to the idea of expanding Medicaid. They're comfortable with it as we stand right now. But Republicans, some still need convincing, and those that maybe are open to the idea certainly are not in any hurry to move on it. If more Arkansans are going to get health care coverage, the work to make it happen starts in this room, the House Public Health Committee. Today, the head of UAMS, Dan Ron, telling committee members the state's largest teaching hospital supports adding 250,000 Arkansans to the Medicaid roll.
We need to be all talking from the same information and all working toward the same ideas for solutions.
Ron says if the state expands Medicaid and adds a health care exchange, the amount of uninsured in the state would drop from 500,000 to 100,000. And the burden on UAMS for uncompensated care, those are patients who show up at the hospital without insurance, would drop from $66 to $38 million a year.
Right now, we're experiencing a lot of adverse health outcomes for the uninsured population that everyone's paying for. And so there's a health impact, and there's also the financial impact.
While UAMS and hospitals are comfortable expanding Medicaid, legislators, including Public Health Committee Chair John Burris, isn't ready to jump on board yet.
There's nothing wrong with waiting and seeing how other states implement this, how it affects other states and the decisions that they make. I don't think there's any harm in waiting at all.
And making sure taxpayers get the best deal. Republicans really hope the feds will allow them to have some more flexibility in how they want to expand Medicaid if it's going to happen in Arkansas. But at least as we stand right now, the feds say it's all or nothing. Live outside the state capitol, David Goins, Fox 16 News.
Yeah, certainly a lot at stake here, David. The governor's been very vocal about this, and he's hopeful that legislators can reach a deal on this. But when it comes to that all or nothing stance by the feds, is that really set in stone?
At this point, it seems it is, Kevin. I mean, it kind of makes it tough for Republicans. They'd want to talk about Medicaid expansion, but they don't want to be told either all or nothing. Beebe has said, look, if the legislature can come up with some type of Medicaid deal this session, he can ask the feds if Arkansas can have some flexibility, and maybe Arkansas can be a pioneering state for their own type of Medicaid expansion, but still a lot of work to be done.
Yeah, good point. David Goins reporting live.